how do you reduce the possibility of a fracture in a zirconia
Sure.
prosthesis?
Well, we talked about the thickness of the zirconia as one aspect, but there's also when you have too much of an extension, where there's a distance between the implants that are placed, or they want to go too far distal past that last implant, and you end up with this extension. A good rule of thumb is you only want to extend on the distal extension. You only want to extend about one tooth past that last abutment, as a general rule. Anything further than that, of course, you're cantilevering that zirconia out. And if you think about it, there's an implant right there in front of that extension, and that's where all your zirconia is thinnest. And we'll see them where they just cantilever down, and it cracks right there with that last implant, and you're back to remaking it again. So you can't extend too far. And then also, again, if you need to, or you feel inclined to, again, the titanium bar is what goes in there to fill that. And so you could extend it back. We know that sometimes the patient, when they smile, they don't want to see no teeth back there, right? So they might, they're going to encourage you to extend one more tooth back so that it's aesthetic and they don't see it when they have a broad smile. Well, you're going to have to tell them, hey, you're going to have to move to a titanium bar underneath there to give you the extra strength. And then you can kind of get back a little bit further, maybe in another tooth or so. So those are just some general rules of thumb. Again, but with the advent of the titanium bar, we just see that being used more and more as this whole technology has kind of blossomed and grown. And we've kind of taken our hits, along the way, and learned, hey, look, this stuff is not bulletproof. It will break. even though it's really thick, it'll break, and you have to handle it with respect. So that's how we handle the long extension issue.